Assalamu alaikum wa rahmatullahi wa barakatuh. May the peace and blessings of Allah be upon you, dear viewers of MTA Africa. We are broadcasting from Uganda Studios, and of course we are reaching all the corners of the earth. This is Health Check with me, Nahoho Rashid Matselere, and today we are looking at the science of pain, or the concept of pain. I know when we speak about pain, each and every one of us, we have ever experienced pain. And as I speak now, I know some of you who are watching us, viewers, you might be having pain. But what are the causes of some of the pains that we get? And why should we be worried? And how can we prevent certain pains? To take us through this discussion, I have a doctor, that is Dr. Kisawe Ahmad, and he is here to take us through this. Doctor, you are welcome to this program.
Thank you very much.
You can say salam to the viewers.
Assalamu alaikum wa rahmatullahi wa barakatuh.
We are talking about pain. And you are an expert in physiotherapy.
Yes.
What is pain? Let's start with that. What is pain? If somebody asked, what is pain in the language of science?
Right. Pain is something we've all experienced, I believe. Yes. And it is the most common reason as to why people go for healthcare. Yes. For physiotherapists, a variety of patients that report to us, yes, come with pain as their main complaint. And according to the International Association for the Study of Pain, it gives a definition of pain as an unpleasant emotional or sensory experience, yes, that is attributed to actual or potential tissue damage, or described in such terms. Yes.
So, according to science,
yes,
when somebody feels pain, what really happens to the body?
I'll give an example that is most common to all of us. Let me say you draw your finger towards a burning candle or a burning stove, yes? At that point, you will feel the burn, yes? And you will immediately pull away, yes? At the point, after you pull away the hand, yes, at the point that you are burnt, you will slightly feel some pain, yes? If I was to explain this to break down the process, you see this process of you taking the hand, pulling it away, then feeling the pain. It happens in a few milliseconds, yet it is a very complex process that has happened. So to understand the science of what happens when we experience pain, we have what we call nerves in the body, yes? The nerves are like an extension of the brain. The brain is mainly situated in the head, yes? But to reach in all the other parts, it has branched off as nerves. And these nerves are what pick up such stimuli. We call it stimuli. Yes, stimuli is something, an event or a situation that evokes or arouses activity for a functional or specific organ. Yes. So when you pick up a stimuli, that is, let me say the burning is the stimuli. Yes, but that is a bad stimuli. So the nerves transmit that to the brain. Yes. The brain then evaluates and compares from previous experiences what you're feeling. Yes. And at that point, when the brain finishes to evaluate, that's when you perceive pain. Yes. So you see, the nerves are picking up the stimuli, but they're taking to the brain processes, then you feel the pain. But you might feel that is a process that is a bit long, but yet it happens within a few milliseconds. That's how fast it is, yes? So after we do experience the pain, yes, someone might ask then, but why do we feel the pain? Why does it always happen?
Yes.
Yes. Pain is a protector. Pain
is a protector?
Yes, it is a protector. pain gives us the energy to avoid injury or further injury, but it also gives the chance for you to heal. Otherwise, if you didn't have that concept of pain, yes, you'd leave your hand at the burning candle and it will be burnt and it withers away, yes? But because you felt that slight pain, yes, you pulled away, yeah? You avoided more injury, thus giving your body a chance to heal, yes.
Now, doctor, you have said that you've given us an example of a candle,
Yes.
of a pain. But there are situations whereby one might not experience pain even if he or she is exposed to something which he must feel pain. For example, somebody might be sick. Let's say he has an injury on the leg and maybe something scares him or her, but he runs very fast, and maybe after some time, that's when he or she starts feeling pain. What happens in that process? What makes one to forget this pain, that you cannot feel pain and you start taking off, then after some time you realize, oh, I've hurt myself. There are even sometimes that somebody can even cut himself unknowingly, and it's after some time that the pain comes. For example, people who are shot with bullets actually have people have given experience that actually when the bullet enters the body, most of them don't know. Actually, it's just after some time that the pain comes. How do you explain that as a scientist?
All right, there are quite very many questions in the ones that you asked. So I'll start by answering the first one. There could be medical conditions, yes? A medical condition like leprosy, it somehow inactivates your nervous system. So that pain transmission and pain perception is somehow faulted. So you may not feel the pain, yes? If you, let me say, put your hand at the burning candle, you may not feel the pain because the nervous system that is responsible for that transmission and the pain perception is not working. For the other incidents of, in case of a time of fear, or when you're occupied by things like war, there is a way the mechanism of the body works, yes? The body is tuned to make sure you're focused on what is most important, yes? So we have systems in the body. We have what we call the sympathetic and the parasympathetic. These systems come into play. The sympathetic is supposed to make you more alert, more aware, yes? And it shuns away the parasympathetic that is meant to give you the awareness of pain, yes? So at the time when the sympathetic system is active, you won't feel other unnecessary distractions that could be pain, yes? So that explains that scenario where perhaps you're running, you're being chased by something, then you step on a thorn, but at that point you don't feel the pain, yes? But after you've evaded whatever was chasing you, then you start to feel the pain, yes? Because at first the body tried to focus on survival. Then the issue of pain comes in later because at the point it wasn't really something that you had to focus on. Otherwise, the issue of survival would then be null and void. So the sympathetic system, in a way, inactivates the systems of pain, yes? Or it may not be only pain. At that point, you might feel like you wanted to urinate. But the moment the fear comes in and you're struggling for survival, you don't feel the urge to urinate. You
forget everything.
Yes, but then you remember to urinate after, something like that. So the body has a way of tuning according to the experience that you're getting at that point. It focuses more on what is more important, yes? So the point of the bullet entering your body, then you don't feel the pain, but you feel it after something like that, or after some time has passed. It is about how the body arranges the systems, yes? So the sympathetic takes precedence over the parasympathetics, yes? So that is how that science works.
So what could happen? Let's imagine a situation. What could happen if we could not feel pain at all?
Well, if we could not feel pain at all, like I first told you, pain is a protector, Yes. Pain motivates you to do something, to avoid injury, to give your body a chance to heal. So if you wouldn't feel pain, you would you will be susceptible or very vulnerable to destroying many parts of your body, which eventually will lead to your death without you knowing, without you being warned. So pain is like a necessary, someone would say a necessary evil. Yes, because pain is not really a good thing, but it is a necessary thing to give us a warning that there could be some potential tissue damage that you might need to look at. Like I've told you, the most common reason why people visit healthcare is because of pain. Yes, because if pain wasn't there, then people wouldn't go for healthcare. Yet inside their bodies, something definitely wrong was going on. So pain is something that is needed, a protector.
As you have said, it is a necessary evil.
Yes.
Like that. Let's talk about the types of pain. Because for us, we know pain is pain.
Yes.
But maybe you can break down the types of pain.
Before I would like to highlight about the types, I would just say a few things about the causes, because there is a way they relate to each other. So the cause of pain is mainly classified by the kind of damage it has caused. Yes? So there are mainly two categories. We have nociceptive. The words are scientific, but I'll try to break them down.
Yes, yes.
So nociceptive. Septive comes from the word of perception, whereas noci is a Latin word that means something bad. Yes? So nociceptive is like bad perception. Yes? So the nociceptive pain is that pain that comes when you get eventual tissue injury. Let me say if something pricks you or if something burns you, that is nociceptive pain. The other kind of pain we have is what we call the neuropathic pain. This pain is more related to tissues inside the body, like the nerves. I'll give an example.
These are all causes.
Yes, I'll give an example. Let me say, this is a metaphorical example. Let me say you had your mobile phone in a hand, then it slipped and fell down, then it was crushed on the floor. That would be the example of nociceptive pain. The other example is if you had the mobile phone in your hand, it fell, but when you picked it, it was physically okay, no signs of crushing, but inside there is a component that perhaps got broken, like a microprocessor, yes, that is responsible for the internal workings of the phone. Physically, you wouldn't see anything wrong, but inside there's something wrong. That is what we call the neuropathic pain, yes. The other kind of pain is not really the common type, but it is psychogenic pain. It is most related to psychological issues. Yeah, those are, like I told you, the classification is due to the kind of damage that causes it. So that is how we classify the causes. We have the nociceptive causes, the neuropathic, and the psychogenic.
So where do our sicknesses fall among all those pains?
The sicknesses, depending on how they present. Yes, because this one will be then the work of the clinician to tell you, after getting information like history from you, they would then deduce that this kind of pain is nociceptive, this kind of pain is neuropathic, this kind of pain is psychogenic. It would be a longer discussion to describe what the different examples that fall under the causes, but that is it.
So what are the different types of pain? Okay,
then for the different types, there are very many types. But depending on the different systems. In the body, we have very many systems, yes? We have the nervous system, the musculoskeletal system. All these systems, there is a way they tend to respond differently to pain. But I'll talk about the most common types. I've already talked about the two, the nociceptive, the neuropathic, and the other rare one, the psychogenic, yes? But we also have radicular pain. This kind of pain is a bizarre kind of pain. I may have pain at my back, on my back, but then this pain radiates to my lower legs. Yes, that is what we refer to as radicular pain. The pain is not necessarily in the legs, but it is at the back. But because of how it progresses, it radiates to the leg. The issue is with the back, not the leg, but then you also feel pain in the leg. That is the radicular pain. The other kind of pain, these are most common ones that people have had, is what we call acute pain. Acute pain is pain you experience for a period of few days, few weeks, and few months. But it is most commonly affiliated to nociceptive. You remember nociceptive? Where you get an external stimulus that causes the pain, like something pricks you or something is burning on your hand. Yes? That is the acute kind of pain. The other kind of pain is the chronic pain. The chronic pain is pain that is experienced for 3 months or more. This kind of persistent pain is the pain that is a big problem in the world right now because there is no clear solution to it. Most professionals would agree that body tissues heal within a period of 3 months, most of them. Yes? So the chronic pain, it is clear or it is evident that it is not pain that is related to tissue problems, like is the tissue having a problem? No, because by the time it is persistent for more than 3 months, then it is not really an issue with the tissues. That is a kind of chronic pain. But this kind of pain, it has been stipulated by different researchers that it is pain that is produced by your brain. And you wouldn't want pain that is produced by your brain, because some people tend to think that there is something really wrong going on with them. You may think you have pain at the knee, but when the knee has no problem. Yes? That is a kind of how chronic pain presents. The thing is, pain is something you learn when you're very young. Yes? You learn to detect, to sense it, just like the way you learn skills of reading, writing. Yes? But the longer you experience pain, the more your body becomes better at it, in a way that you become more sensitive to the pain. It's like an alarm going off without an intruder in the house. Yes? But this is all because of the sensitivity of the nervous system. The more it becomes sensitive, the more you perceive this pain, yes, which is not a good thing. So this kind of pain, in scenarios, people could be helped if you retrain the brain and if you retrain the nervous system, yes, to help you to reduce the sensitivity of this kind of thing, yes.
And how can you retrain the brain?
Yes. So there are different things that do affect or contribute to the experience of the nervous system becoming more sensitive. Yes? And when we are treating this kind of pain, mainly chronic pain, we focus on 6. Or there are very many other things, but the 6 are most common. One of them is medicine. Medicine in itself is not really the sole solution for chronic pain, but it can help to a certain extent. Yes? Yeah. But when you want to retrain your brain, you don't want to rely on passive means. What I mean is taking medicine is more passive because it does not involve you to do something like physical or something like that. So in order to retrain your system, your nervous system or your brain, you need to do something active. And taking medicine isn't really something active. Yes? So when you're treating chronic pain, medicine isn't the whole solution. You have to consider other things. The other things then would include thoughts and emotions. Pain has an influence on our lives, a very big influence, yes? In a way that it can affect your mood and stress levels, which can leave you with feelings of hopelessness, depression, yes? But these are all thoughts that are formed by your brain. But when you learn how to reduce your stress and wind down on your neural system, it can help to improve your emotional well-being, thus reducing the pain you feel.
Is there a chance that the body can be trained to be resistant to pain?
Yes, it can be. And of course, thoughts and emotions too can, when you improve your emotional well-being, that is one of the things that can be used to reduce the resistance or the threshold that you feel pain. Yes? I was still talking about the factors. I've already just talked about the 2, the medicine and the thoughts and emotions. The other one would be diet and lifestyle. Yes? Our modern and busy lifestyle is not really always good for us. This lifestyle can contribute to how you experience the pain. Yes? Lifestyle, I'm talking about things like nutrition, amount of sleep, the amount of work, how you choose to relax. If you choose to address these issues, if you are a sufferer of chronic pain, it could be a good beginning. The other factor we could talk about would be physical activity and function. Yes? If you get yourself moving at a comfortable pace without relying on the fear of exercise, the moment you bring in fear of exercise, there is a way it leads your brain to that kind of protection. Yes? And there is a way the brain uses pain as a way of protection. So fear is one of the things that you need to cut away. But if you adopt or if you opt to do physical activity and function, it should be at a level that you're most comfortable with, a level that is not going to induce you to have fear. Yes? Because the more you improve your physical fitness, research has shown it, the more you improve your physical fitness, there is a way it tends to improve your general well-being in a way that it secretes chemicals. Yes, these chemicals that keep you happy, keep you in a good mood, which are then responsible for reducing your experience of pain. Yes? The other issue that I will talk about is a personal story. Very many people have different reasons as to why they might experience pain, and people generally experience pain on different scales. Yes? People link pain most times to an emotional occurrence in life. Yes? These emotional occurrences could be tragedies, could be trauma. Yes? So if you suffer of chronic pain, you would maybe want to look at the things that happened at the time you started experiencing pain and how you could definitely go about this. You could seek assistance from therapists to help you, because these experiences, the more you hold on to them, there is a way they affect your sense of perception in regards to pain.
Doctor, you've talked about the aspect of physical exercise.
Yes.
There are people who do exercise and after some time they feel a lot of pain.
Yes.
What is...
Okay, if you're a person who has never done that specific physical exercise, of course you will be tasking your muscles to do something more that they've never done. Yes. So that point of doing a new thing, there is a way it tasks the muscles. Yes, in a way that the muscles have to tear and reform to adjust so that they can be better able to do that physical exercise the next time you attempt to do it. But this pain doesn't come when you're doing the exercise, it comes after. Yes, we call it delayed onset muscle soreness. But this kind of pain is not that pain that is bad pain. Sometimes we call pain sweet pain and bad pain. Yes, if you get chili and you put it in the food and you eat it.
Yes, yes, that is sweet pain.
That is sweet pain. It's not really bad pain. That is sweet pain, yes? As I told you, you may relate pain to something that is an ache, a burn, yes? But even the sensation you get when you put chili on your tongue is referred to as pain. Because remember, our definition was an unpleasant emotional or sensory experience. And that, if you've never had chili and you put it in the food the first time and you taste it, it will be very unpleasant. So that is pain also, but that is sweet pain.
So there are some people, there are some people, whenever they get some little pain,
yes,
they take painkillers. Does this have a side effect that whenever there is a pain, you should take painkillers?
The problem is the pain has very many variations. I've told you the types are very different. You might take painkillers and it helps. Like I talked about medicine. Medicine does help at a limited extent. But it is not always good to take painkillers when you get pain, then you take painkillers. It's not always good to self-medicate yourself. It is always good to go and you seek further professional from the doctors or the clinicians. Yes? Because acute pain, what I didn't say earlier, acute pain can progress to chronic pain if managed, if it wasn't managed well. So you don't want to risk getting chronic pain because of something you did when the pain was still in the acute stage, which acute stage is easily resolved with very good professional, yes, doctors.
Now, I'm looking at something, you know, this subject of pain, yes, is something which is very wide and many people have experienced this every day.
Yes.
But me, I'm a religious person.
Yes.
But you find there's a situation where somebody gets pain maybe is an illness,
Yes.
and he or she is passing through a lot of pain, doesn't take medicine, and just has that willpower, the belief that I will get okay, and ultimately the pain goes away without any treatment. Does this have let's see the psychological part and the physiological part? What brings this?
The kind of pain that goes without intervention isn't something that is research-based. These are subjective experiences, and we cannot really use them to generalize, yes, and we cannot say people can adopt such ways. But as I've told you, it is subjective. It can happen on one person, but it may not happen on every other person, yes. Psychological pain would not be pain that easily goes away without intervention, because that really requires someone to get someone else to help them understand their own pain, yes, other than them being with themselves and perhaps meditating, something like that, yes?
Yeah.
But prayers are something that definitely you cannot rule out, yes. Pain is not really a science that has been generally understood. It is a science that we are still exploring, yes. So there could be instances where we too cannot explain what really happened. Like in the case that you've explained, someone has that willpower and all of a sudden the pain disappears, yes. But from the clinical point of view, we wouldn't really encourage someone to do that. We would encourage someone to come visit the clinicians, the physiotherapists, then they diagnose the person and tell them about their pain, yes, so that they can find better ways of progressing or healing. Yes.
Thank you very much. Doctor, just in 1 minute, you can make concluding remarks.
As I already told you, pain is a protector, yes. It is something that you should not really fear. When you understand your own pain, you will fear it less, yes, and you will understand what your body is able to do more, yeah. So rather than being there taking painkillers, seeking help that is not professional is not really good. It is better you go on, get someone else to help you understand your own pain, yes. The more you understand your own pain, the less you'll fear it. The more you'll understand, or the better you'll become at what your body is able to do, yes. As I've told you, pain is a protector, so yes.
Thank you very much. I like that. The more you understand your pain, the more you will be able to fight it. And pain is there as part of our life. We should not fear it. Thank you very much, Doctor. And I have been Nahoho Rashid Matsadede, your host. This is all time could allow us to have. Assalamu alaikum wa rahmatullahi wa barakatuh. May the peace and blessings of Allah be upon you. We meet again in another episode, Health Check.